Hi, and welcome to another exciting episode of Ask Dr. Jack, where we answer the questions that you ask. Feel free to email any questions you have to AskDrJackB, that's a B-E-E, at gmail.com, or call up the office, or stop into the office. We take questions from all aspects of life. All right, let's get down to business here. Yesterday, a patient came in. They were all concerned that the people, as they aged in their family, were very prone to get arthritis in their knees. And they were very concerned that, do I have arthritis? What's going on? Should I have an x-ray taken? Well, I came across a study that was done a couple years ago. It covered 4,673 men and women. So a really significant study. It was very awesome. And what they found is that the best determination of arthritis in your knees is if you have pain walking up steps. So if you can walk up steps without pain, you have very little chance of currently having arthritis. So how cool is that to know that? Now, if you do start having some pain when you walk up steps, this test is so sensitive that even if you took an x-ray, you might not even see it on the x-ray yet. So really great way to know about their arthritis condition, because the quicker you jump on an arthritic problem, the more likely the problem is not going to be a big deal in the future. So this is a great test. So if you do have pain going up pain going upstairs in your knees, what should you do? I wouldn't recommend running to a doctor's office and having an x-ray taken. First of all, like I said, this test is so sensitive you might not see anything on the x-rays. Second of all, if you do find that there's arthritis, what are you going to do about it? So why radiate yourself? The best thing to do is to go into a biomechanics specialist and make sure that everything in your knee joint is working correctly. Now, my personal favorite for a biomechanics specialist is a chiropractor, because that's what we do. We check to make sure the joints are working right. And if we do find a problem, it's not like we have to go in to have and give you a surgery to fix it. So that's a bonus. If we do find that these bones are a little bit out of place, that could be why you're having the pain. If these bones are out of place, every time you're taking a step, you're creating microtrauma. And this microtrauma, you might not notice for a long time, but it starts to build and build and build. And pretty soon, it goes over the threshold of pain, and you wonder, when did it really start? I guess I noticed something a couple months ago, but, not really consistent. Now it's getting consistent. So we get these things back into place. Maybe take something to get some of the inflammation out of there. All of a sudden, now you have no more pain going upstairs. Also, it reduces the likelihood that the arthritic condition is going to progress, if it's even there at all. So, my opinion, take it for what it's worth, that would be the best place to start on this type of condition. That concludes another exciting edition of Ask Dr. Jack. Please give us your questions so we can give you some answers.